Hello, Section 3. Welcome to the last weekend review or weekend recap. Hope you all are doing well and are able to take a deep breath. I'm certainly not going to ramble on this time. I'm going to make this pretty quick. You're not going to get a review of all the literature and the highlights. I'm just going to quickly, very briefly go through this. You guys have done a great job, and I just want to kind of wrap things up. So, group projects. It's interesting that it was a fairly complicated case. There was 5 problem areas, if you will, and of those problem areas, you all really honed in. And some of you came about it in different ways, but everybody ended up coming back to the hip and the lumbar spine, focusing on that as the first line of defense or offense, I guess, depending on how you want to look at it. You focused on mobility and strength of the hip, looking at nerve mobility, joint mobility, decreased pain through mobilizations, and this combination of manual therapy and exercise, which was really good. Some of you, a lot of you focused on, and I think that this is true for a lot of people, mobility first, and I think that that's okay, but I would say that sometimes I don't think we exercise our patients enough, and strength needs to be an important part of it. Everybody had strength in there eventually. I might argue that strength needs to be more on the forefront. Mobility is important, but don't forget about strength. Make people work. Make them challenge them. So, group projects. Everybody did a great job, I thought, and then the kind of the back and forth that went on was really good too. Good questions. All around just a good job. Functional testing and sports progression and I thought that was a really good guide for people who have to return athletes to sport who don't do it often enough, so they're not used to it. David James does a great job kind of giving you some guidelines and parameters. And granted, we talked about this too. There's just not enough information out there right now about having specific to every individual for every sport. And eventually there's going to be more, but it truly is something that you need to keep up on, especially if you see these athletes and want to have a better idea. The foot and ankle pathology presentation by Flynn was really good. I think everybody should be looking at people's feet who have diabetes. We should be educating people. We should be making sure that they are aware and that they have a good idea of what they need to be watching for. And I think Flynn does a great job of outlining what we need to be looking for. The stress reaction force stuff was really good for those of you. For some of these people, this wasn't a big deal because unless you see athletes or people who go into something, maybe weekend warrior kind of people, that you aren't going to come across this as often. But, you have to be able to know what this is, recognize it, best way to deal with it. Not a lot of great research on it, though. We are limited by things like orthotics and immobility and, and diet, that kind of stuff isn't going to make the dramatic impact that a manip would make an acute low back. So frustrating. So then the questions, those are all the questions that were posed for week 8 for the responses were all really good. But what I honed in on was the response, the evidence and experience and patient values, the stuff that Julie talked about, and how you guys all honed in on that and that kind of response to clinical growth. I think that's really, really important. Self-reflection is huge. And being able to understand that the 3 legs of the stool all have their place, one not more outweighed than the other. And I could hear that being echoed in your posts about how, you take a course like this and you start to lean heavier on the evidence and you forget about patient values, or you forget about maybe what a clinician in your clinic who's had 20 years experience, who has done a lot of manual therapy but doesn't really know the evidence, might have to offer. And we need to weigh all of those things, and I think that that's really important. And I mentioned in a couple of people that when it comes to patient values, you can't stress empathy enough. And I just can't hit that home, that your ability to listen and make the patient feel understood is critical, is absolutely critical for them to have a great experience, because then they can take what you have and you can even add a placebo effect to that, because you have gotten not only your treatment response, but then a little bit more because they trust you that much more. So I really enjoyed reading those. I thought that it kind of summarized everybody's struggle to grow, to become that ideal clinician, and how balancing all those is really is a challenge and not easy. Lastly, you did it. You made it. Congratulations to all of you. It was a great course. You guys are just great students. You really helped me out. I know I want to say thank you to both Pierre and Joseph, who did yeoman's work in trying to get to help me. I really appreciated their efforts. It was It made this course a lot easier. You guys did a great job. And to the other fellows who are taking the course, I appreciate your efforts in showing leadership in the group projects and then throughout the coursework and connecting with me if there was anything that you thought was important. And then everybody else who participated so eagerly throughout the 8 weeks. It was really what made the course that much better. So best of luck to all of you in your future endeavors. If you ever need anything or have questions, feel free to contact me. I've had many students contact me from past classes who have wanted recommendations, literature, what have you. Feel free to do so. I'm always available. So enjoy your spring and into your summer, and maybe we'll see you in another course or perhaps at AAMPT or at CCSM. Take good care. Best of luck to you all.